Thank you so much.
Yes.
So, all the women in my family suffered from obesity, including my grandmother. I struggled for 20 years. I was an obese little girl, an obese teenager. And now for 20 years, I've maintained a 90-pound weight loss.
Amazing.
And one of the things, thank you. One of the things that I've learned, I have satiety, the gift of satiety. I eat pretty much a nutritarian diet. Mm-hmm. The only time that I lose it is when I'm angry, lonely, jealous, overstressed, going through grief. I lost many of my loved ones. So it's such, and the foundation for me has been meditation.
Mm-hmm. That's great.
A conscious contact with a higher power that's helped me, in many ways. And, I guess I just wanted to stand up and let people know that I work with people all the time who use meditation as their foundation and a plant-based diet, and watching emotions and making a distinction between the illusion of hunger when these emotions come up and, working with that.
Yeah.
And it's a way of restoring people back to their true selves as well as their ideal weight.
Yeah, that's great. Actually, my next book is almost exactly about that. I'm looking at people that have been able to lose weight without anything, without surgery, without anything, and what did they do to be successful? How did they break away from this? Like, I kind of paint a negative picture that if you're 500 pounds, there's no way you're going to lose weight. But what about the people that did? That's my next book. What can I learn from those people? What did they do? And I like that meditation's one of them, because that's something I haven't put in there yet. But I've been trying to meditate. I did a 10-day silent meditation retreat, but I lasted 7 days. I just could not do it. I had to quit. That was harder than an Ironman. Yes.
I have a different kind of question. It's for a friend who's trying to do the plant-based diet, but she's actually underweight. Is there anything other than eating more carrots that somebody can do?
Carrots? No. It's oils. You want to start going up that calorie density chain. So you want to start, instead of eating the lower calorie density stuff, it's nuts, seeds, oils, and a little bit more denser carbohydrate like potatoes and things added into it. Yeah. Yes.
One of your recommendations, you had it on the screen, but you went over it very quickly, was to eat over a 10-hour period.
Yes.
How important is time management in the whole scheme of things?
Yeah, I don't know. The evidence right now, it's funny enough because I just got back, social media kills me. You guys see me get angry on there. I get angry because I have such scientific discussions with my team, and then I go on social media and someone's like, "You're wrong, you're right," and they don't know what they're talking about. We had a really good discussion about this. We were reviewing all the literature. There's pretty strong evidence that time-restricted eating, which is different than intermittent fasting. So time-restricted eating is, I'm going to eat over a 10-hour period, I'm going to eat over an 8 to 10-hour period, does work pretty well. I think part of it has to do with something you kind of mentioned on, which is I try to teach patients to understand these hunger cues and to understand that you're not going to die if you're a little bit hungry. We're such a culture now that, oh my God, I'm hungry, I better eat right now or I will die. That's not true. And once you kind of learn that that's not true, you tend to eat less calories. It's not that time-restricted eating, that there's some kind of magical formula where all of a sudden weight falls off. You just tend to eat less calories when you do that. You tend not to graze as much. You tend not to nighttime feed. There's definitely evidence that eating food earlier in the day. I think Dr. Greger's had some videos out recently where I didn't see the actual video, but the beginning of it was like, eat breakfast like a king, lunch like a prince, and dinner like a pauper, which I love that. I kind of flip the breakfast and lunch a little bit. I tell people to do a light breakfast, big lunch, and then very light dinner and nothing eating after that. There is some evidence to support it. It's not the end-all be-all, but there is evidence to support it. But here's the caveat. So I was all about supporting that until I sat down. I told you we have a pretty comprehensive group at our weight management center, and my psychologists were all over me because we have a lot of people, obviously, with eating disorders, and they feel like these time-restricted eatings and intermittent fastings are the new age way of creating anorexia. I don't know that I agree with them, but there was a 2008 article that definitely showed that people that practiced intermittent fasting had an increased rate of eating disorders later. However, they were following intermittent fasting, which is different than time-restricted eating. That's a longer period of fasting, like a whole day off, things like that. The evidence is there, but it's not there so strongly that I think it's the absolute end-all, be-all. Does that make sense? Yeah.
Hi, Dr. Davis. I wanted to just tell you a little bit about a case and see what you can tell me what you know about the evidence of weight loss. I'm a community nutritionist. There's this guy's about 50, 60 pounds overweight. He's been really excellent at moving to the plant-based diet. Lost about 10 pounds, but and he exercises, walks his dog morning and night, and then does other rigorous exercise about 2 to 3 times a week. But works in a very high stress work environment, very sedentary during the day. So just can't seem to break past losing this 10 pounds despite being very compliant. The only other thing I see in the food log is that he eats a lot of nuts as his snacks at his desk for satiety. Yeah. So I wanted to, I realize you can't give medical advice, but just based on that type of scenario, would it be microbiome? Would it be the nuts, or would it be cortisol? Like I keep hearing
all of
about
those
the
things.
cortisol.
All of those things. Yeah, they all contribute. So cortisol is definitely a problem. We see it a lot in people that exercise too much with high cortisol levels. High protein can cause high cortisol levels if he's really trying to focus on protein. Liquid calories, a lot of people think protein shakes are good for them, so they're getting these easily absorbed calories. Nuts are high calorie density. There was a study in that Predimed study that Dr. Willett referenced. Increasing nut consumption did not seem to be associated with increased weight, but I don't believe it. And it was it was funded by the Nut Almonds Association, but I don't. It's not because they funded it that was the finding. I just think it was too broad of a study group in order to. It wasn't a real. We're going to give you nuts and you not, and follow, and everything else is going to be held equal. I think nuts are very high calorie density, and so if he's constantly snacking on nuts, that's why I like a very, very set eating time. Like this is something I have found both in myself and with my patients. Doing something 99% is hard. Doing something 100% is easier. Meaning, if I've got I am going to eat at 1 o'clock and I'm going to eat at 3 o'clock and that's it. Like I'm going to have my snack at 3. I'm hungry at 2. I'm eating at 3. There's no question. But if I got 90, well, most of the time I'm going to do that. Then I'm constantly like, well, maybe this is my 1% where I do. And then you end up snacking all day. And so snacking could be a real problem with that. It's an easy way to get calories in without doing it. And then, of course, this whole idea that people just cannot count calories. They do not get the idea of what a proper portion size is or how many calories are in certain foods. And so when we have a patient like that, we go through all of these things with them. We try to get them less concerned about exercising and more concerned about how many steps you get in a day. So we use pedometers, wanting them to get 10,000 steps, however you can get it, because there's been a lot of studies that sitting all day and then going and doing a 30-minute workout is almost worthless. Not worthless, but not as good as getting 10,000 steps a day. We want you to get 10,000 steps a day. We go over what are you eating specifically, take pictures of it. Let me see the pictures of the food. We could cut calories here. Sometimes all you need is just a little shift of 100 to 200 calories a day, and then all of a sudden you got weight loss going on. But these are hard issues to deal with. Yes, Sam.
First of all, thank you for the work that you do. I love your compassion and your passion.
Thank you.
I wanted to ask a question about cool sculpting. I have a lot of friends that have been talking about it. I don't know if it's one of those fad type things or if in fact there's some science behind it. But if you have any information that you can share, I'd appreciate it.
It's completely worthless. It's worthless unless you are pretty darn lean. Like you're of the 6-pack, you've got a 4-pack and you want those extra 2-pack. Then it will work on like a small little area. What it is this little machine, it sucks your fat into it and then it freezes it. and it breaks down the fat cells. And it works if you got a little tiny, like, oh, I got a little bit here. But I see people coming in like they've got this much. It's not going to do anything for that. The other thing, it was a pretty interesting study done on liposuction. So they took a group of people and they had them lose 20 pounds. They lost, it was 20 or 40 pounds. No, it must have been 20 pounds. It was 20 pounds with weight loss surgery versus a group of people that lost 20 pounds with liposuction. And the liposuction group had almost no effect on their metabolic health, whereas the 20 pounds lost with the weight loss surgery had tremendous effects. Well, why is that? The fat in the subcutaneous tissue is not that metabolic. When we want people to lose fat, I want them to lose fat from their insides. I want to cool sculpt their liver, but I can't. So cool sculpting the subcutaneous tissue is purely a cosmetic procedure, and it is only for people with the slightest bit of excess fat. Yeah.
Thank you for your passion for caring, Doctor.
Sure.
Dr. Greger states 40 minutes of exercise a day. Dr. Popper states 60 minutes of exercise.
Yeah.
What's your take on
The research is actually 60 minutes, but there's a difference between the research and my patients. And I know that, they're not going to do 60 minutes 5 days a week. They're just not going to do it. 300 minutes a week is what the research is showing is the most effective. But if I could get them to do 150 minutes a week and get them at least interested in the exercise and out moving, it's at least some benefit. So I start with that and gradually improve based on the assessment I get from the patient every time I see them as to how they're doing with their exercise. Yeah, more is better to a point, not until, sometimes more is too much, but 300 is probably better than 150, but 150 is better than none. Yeah.
Yeah,
Yes.
I have a question about weight loss and therapy. I have a couple of friends that are morbidly obese, and some of them have had bariatric bypass, but I keep on telling them I don't believe in the bariatric bypass, that they should go and see a therapist to figure out why they overeat.
Right.
Like some of them are emotional eaters, and getting this is a quick fix, but they're still 600 pounds.
Right.
Like,
So-
what do you feel about therapy?
Yeah, well, therapy's huge. We do it in our clinic. I would say, I would caution, you can't really say I don't believe in weight loss surgery. This isn't a belief thing, it's facts, right? I presented the data. The data is, there's no question on the data, 30-year data. There's more science to this than there is to global warming or any of the other things we talk about. The science is that weight loss surgery works. Now, it's not gonna work in everybody. These are percentages. There's no doubt that there's psychological problems. There's no doubt that there's trauma. In fact, there's a ton of our patients with traumatic issues. All of our patients go through a preoperative psychological workup. So no one could have surgery without psychological workup. Anybody that's got issues has to go through a psychological, I hate the term, but boot camp. And then we do a lot post-operatively with them, so it's a very important part of being successful. So you could get the surgery and you could do everything pretty well, but then have all these psychological problems that cause you to self-sabotage. And there's a lot of patients, the psychological problems after surgery are really interesting. Like a lot of people, most people, it's like, oh my God, I feel fantastic, look at these great clothes. Some people, it's like, oh my God, I was raped as a child, and now men are paying attention to me, and it's very uncomfortable. I'm going to eat to put back on some of that fat so people aren't paying attention to me. I hear all these things. People noticing me bothers, all these kind of things. And so self-sabotage is a real issue. So weight loss surgery, and not just weight loss surgery, any weight loss needs to be a holistic approach. It can't just be diet. It can't just be exercise. It's got to be sleep. It's got to be what you're eating. It's got to be how much you move. It's got to be what your stress level is. Are you meditating? All these things, this holistic lifestyle approach to be successful. Yeah.